Autonomic supply of the head and neck. The autonomic supply of head and neck sure can be divided into sympathetic supply and the parasympathetic supply. And we all know that the sympathetic supply is closely related to periarterial plexus. Therefore, let us remember the main arteries in the head and neck related to the periarterial sympathetic plexus. In the root of the neck, there is a common carotid artery, and the common carotid artery then divided into external carotid and internal carotid arteries. Also in the root of the neck there is a subclavian artery, and subclavian artery give branch called inferior thyroid artery, which supplies the lower part of thyroid gland, inferior thyroid artery, and very important branch from subclavian arises upward called vertebral artery. These are the arteries closely related to the sympathetic supply and the perivascular sympathetic plexuses. The sympathetic supply of the head and the neck is derived sure from cervical part of the sympathetic chain. The cervical part of the sympathetic chain lies lateral to the vertebral column. The cervical part of the sympathetic chain, right sympathetic chain and left sympathetic chain, lies lateral to the vertebral column and embedded in the posterior wall of the carotid sheath. The common carotid artery and the internal carotid arteries are surrounded by a sheath called carotid sheath. This carotid sheath containing common carotid artery and at higher level containing the internal carotid artery. And lateral to the carotid there is internal jugular vein, and this sheath surrounding the carotid arteries and the internal jugular vein is called the carotid sheath. Embedded in the posterior wall here, the sympathetic chain. Embedded in the posterior wall of the carotid sheath. The sympathetic chain lies posterior to the common, this is the common carotid artery, divided into external and the internal carotid arteries. And this ganglionated sympathetic chain containing superior cervical sympathetic ganglion, middle cervical sympathetic ganglion, and the inferior cervical sympathetic ganglion. Therefore, the cervical sympathetic chain containing three ganglia, superior, middle, and inferior. The sympathetic chain lies posterior to the common carotid and the internal carotid artery. This is a lateral view for the neck and for the common carotid and the internal carotid artery anterior, and posteriorly there is the sympathetic chain. The three ganglia, superior, middle, and inferior cervical sympathetic ganglia, receive the preganglionic fibers from the upper thoracic segments of the spinal cord. And these preganglionic fibers passing from the upper thoracic spinal nerves to the sympathetic chain and ascend, these fibers ascend in the sympathetic chain to synapse in superior, middle, and the inferior cervical sympathetic ganglia, which containing the cell bodies of the postganglionic neurons. Then the postganglionic neurons passing from these ganglia to the effector organs. What are the branches and the position and the relation of each sympathetic ganglia? Here in this presentation, I make a beautiful table for the superior, middle, inferior cervical sympathetic ganglia, relation and the position and the branches. First of all, the superior cervical sympathetic ganglion is the largest ganglion. The superior cervical sympathetic ganglion is the largest ganglion. Lies in front of the transverse process. In front of the transverse processes. This is the vertebrae formed of body and the transverse processes. This is the transverse process of the vertebrae. The superior cervical sympathetic ganglia lies in front of C1 and C2 vertebra. Lies in front of C1 and C2 vertebra. And this ganglion lies behind this artery. This is the internal carotid, and the cervical sympathetic ganglion is posterior to the internal carotid. What are the branches of superior cervical sympathetic ganglion? All sympathetic ganglia, superior, middle, and inferior ganglia, gives the cardiac branches to the heart. Then all cervical sympathetic ganglia gives the vascular branches around the nearby artery or the related arteries. The superior cervical sympathetic ganglia gives autonomic sympathetic branches around the internal carotid and the external carotid arteries. Around the internal carotid and the external carotid arteries. And all ganglia gives the communicating branches to the surrounding nerves. The superior cervical sympathetic ganglia gives the communicating branches to the upper four cervical nerves and to the lower four cranial nerves. Communicating branches to transmit sympathetic fibers to the upper four cervical nerves and to the lower four cranial nerves. All ganglia, cervical sympathetic ganglia, gives the visceral branches. Here the visceral branches gives the visceral branches to the related viscera. In this high level, what are the viscera related? The viscera related to this level is the pharynx. Therefore, visceral branches including pharyngeal branches which enter in pharyngeal plexus which supply the pharynx. Therefore, there are cardiac branches to the heart, vascular branches around external and the internal carotid, communicating branches to the upper four and the lower four, upper four cervical nerves and the lower four cranial nerves. Vascular branches to the viscera related, we related to the pharynx, we give the pharyngeal branches to the pharyngeal plexus. This is the superior cervical sympathetic ganglion, which is the largest. This is the smallest. The smallest is the middle cervical sympathetic ganglion, which lies in front of the transverse process of C6. In front of the transverse process of C6. and in front of inferior thyroid artery. In front of inferior thyroid artery. This inferior thyroid artery curve to pass to the thyroid gland, and the inferior cervical sympathetic ganglion and sympathetic chain lies in front of inferior thyroid artery. Here it is very clear, this is the inferior thyroid artery, and the sympathetic chain and the inferior cervical sympathetic ganglion lies in front of the inferior thyroid artery. This ganglion lies in front of the transverse process of C6 and in front of inferior thyroid artery. The middle ganglion gives branches to, as usual, cardiac branches to the heart, and the vascular branches form plexuses around the inferior thyroid artery and gives communicating branches to C5 and 6. The superior cervical gives communicating branches to the upper 4 cervical nerves. Here we gives communicating branches to C5 and C6 nerves. Visceral branches. What are the viscera related to the inferior thyroid? Tracheal and esophageal branches. Visceral branches. Therefore, branches of any ganglion in the neck gives a cardiac, vascular, communicating, and visceral. The inferior cervical sympathetic ganglion. The inferior cervical sympathetic ganglion usually fuse with the first thoracic ganglion to form a large ganglion called the stellate ganglion, like stellate, like a star. Therefore, it is called the stellate ganglion. The inferior cervical sympathetic ganglion lies in front of the transverse process of C7. And the inferior ganglion has important relation to this artery, which is branch from subclavian called the vertebral artery. It is called vertebral because it passes in a foramen in the transverse process of the vertebrae. Close related to the vertebrae, therefore it's called vertebral. And it passes in front of the inferior cervical sympathetic ganglion. What are the branches of inferior cervical sympathetic ganglion? As usual, cardiac to the heart, vascular to the related artery, gives the plexus around the vertebral artery and the plexus around the subclavian artery. And this plexus will continue with the axillary artery to give the sympathetic supply of the upper limb. Communicating branches as usual to the related nerves. The first ganglion superior gives communicating branches to the upper 4. The middle ganglion gives communicating branches to 5 and 6 cervical nerves. And the inferior ganglion gives communicating branches to C7 and 8 cervical nerves, C7 and C8. The inferior cervical sympathetic ganglion and the middle cervical sympathetic ganglion gives the communicating branches to each other called ansa subclavia. Ansa means loop-like. Therefore, there is a loop of nerve fiber connecting the middle and inferior ganglion. This loop called the ansa subclavia. Subclavia because this loop around the subclavian artery. Therefore, it's called ansa subclavia, which is very clear here. Branch between middle and the inferior, connecting the middle and the inferior cervical sympathetic ganglia, and this loop means ansa, around subclavian arteries, therefore it's called the ansa subclavia. These are the sympathetic ganglia and the related nerves. And never forget the main relation of superior ganglion lies in front of C1 and 2, behind the internal carotid. Middle ganglion. Middle ganglion lies in front of C6 and in front of inferior thyroid artery. Inferior ganglion. Inferior ganglion lies in front of the transverse process of C7 and behind the vertebral artery. Behind the vertebral artery. Branches, all gives the cardiac branches, all gives the vascular branches to the related arteries, all gives the communicating branches to the cervical nerves. The first, which is superior, gives communicating branches to upper 4, followed by 2 nerves, 5 and 6, the middle ganglion. Communicating branches in the inferior ganglion is the following 2 nerves, which is 7 and 8 cervical nerves. All gives visceral branches to the surrounding viscera. Superior related to the pharynx gives the pharyngeal branches. Middle related to the upper part of the trachea and the esophagus gives visceral branches to these organs. And the visceral branches of the inferior ganglion is replaced by the ansa subclavia between the middle and the inferior cervical sympathetic ganglia. This is the sympathetic supply. For these details, for more details, the branches. These are the branches. Superior ganglion, vascular branches around the internal carotid and external carotid. Communicating branches. Upper 4 nerves from 1 to 4. And the cardiac branch. For more details, the branches, the vascular branches which form a plexus around the internal carotid, pass with the internal carotid as vasoconstrictor to the branches of the internal carotid. And the branches of internal carotid reach the orbit, reach the eye to supply a muscle inside the eye called dilator pupillae, which dilates the pupil, and supply a muscle called the molar's muscle. Molar muscle is a part of muscle called levator palpebrae superioris, which elevates the upper eyelid. Therefore, it is very important the perivascular vascular branches around the internal carotid pass to the dilator pupillae, which dilates the pupil, and the levator palpebrae superioris, part of this muscle called the molar's muscle, which is a smooth muscle supplied by sympathetic nervous system. The branches, the vascular branches around the external carotid, pass to the skin and visceral to the glands. Visceral to the glands, to the parotid salivary gland, and to the submandibular salivary gland. Branches around the inferior thyroid artery. Branches around the inferior thyroid artery are visceral. Are visceral to the larynx, lower part of larynx, upper part of the trachea, lower part of the pharynx, and the esophagus. Branches around the vertebral artery are vasoconstrictor to the branches around the vertebral artery. Therefore, this for more details. Vascular branches around the internal carotid towards to the eye, supplying dilator pupillae and part of levator palpebrae superioris called the molar's muscle, which elevate the upper eyelid. Branches of external carotid to the skin of the face and to the salivary glands. Inferior thyroid are all visceral. to the lower part of the larynx trachea, lower part of the pharynx and of the esophagus. Around the vertebral vasoconstrictor of the branches of the vertebral. This is the sympathetic supply of the head and the neck. Thank you for good listening and good luck.